Little inspires more fear and anxiety than a medical procedure. Luckily, most doctors and surgeons are required to go to great lengths to master their profession. But let's face it, nobody's perfect. Don Church received a medical diagnosis that everybody dreads. He had a tumor. However, this wasn't a small tumor. It was a 13-pound tumor located in his stomach that had to be removed immediately. So Don promptly underwent surgery at the University of Washington Medical Center. Fortunately, his surgeon was an expert at removing the tumor. Not so fortunately, his surgeon was also a bit forgetful. Don was sent home after his surgery and experienced severe abdominal pain. This, of course, could be expected after the removal of such a large tumor, but more and more time passed. The pain only became worse. He notified the hospital, but he was assured that the pain was normal. But Don knew something wasn't right. Some days he would spend curled up on his bathroom floor, sobbing relentlessly from the pain. Aside from this, he began to develop a metallic taste in his mouth. When he managed to be able to do any traveling, he would set off metal detectors at the airport. He knew something was wrong. These occurrences, months after his surgery, were anything but normal. So Don went to his family doctor, who, while examining Don, felt an abnormal lump in his abdomen. X-rays revealed that Don had a 13-inch long metal retractor sealed inside his body. The tool is used to keep a wound open during surgery, and though counting tools after surgery is typical medical procedure, the surgeon somehow overlooked one of the largest tools of all. Don underwent emergency surgery to have the metal retractor removed and suffered no lasting effects. For his trouble, the hospital paid him nearly $100,000. It was revealed that Don was the fourth instance where a metal retractor was left inside of a patient at that same hospital. Jesica Santillan and her family went to extraordinary lengths to see that she got adequate medical care. At such a young age, Jesica was plagued by a disorder that was killing her. Her heart and lungs were on a path to failure, and no doctor in her home country of Mexico could help her. So her family did what any family would. They worked to find her the help she needed to survive at any cost. Jesica's family actually managed to smuggle her into the United States, and they took up residency in a trailer in North Carolina. Having no money, Jesica's family continued to champion for her cause. They started fundraisers and raised enough money to see to it that Jesica would be able to get a heart and double lung transplant. The surgery would be a life-changing one, even if successful, but for Jesica and her family, it would become a horrifying ordeal. Surgeons prepared to work and put Jesica under anesthesia. The lung machines and bypass were all started and the surgeons were ready to begin. The surgeons' expert hands went to work, and admittedly, they worked well. Jesica's new heart and lungs were transplanted without an issue. Her lungs began breathing on their own and her new heart started beating away. The surgeon was preparing to close her up and send her to the ICU. That's when they received a call from immunology. They informed the surgeon of the horrific truth. While Jesica had type O blood, the organs she was given were type A. Her body immediately began to dispense antibodies that started destroying her new organs, not only wasting perfectly good organs, but putting Jesica into serious jeopardy. Doctors did all they could for Jesica. They found new compatible organs and performed a second transplant procedure. Unfortunately, Jesica slipped into a coma and suffered severe brain damage and died just days later. Her family sued the hospital for an undisclosed amount of money. Neither the family nor the hospital are allowed to talk about the settlement. Sherman Sizemore, a Baptist minister, began to experience unexplained abdominal pain, so he was scheduled for exploratory surgery. Sherman was admitted to Raleigh General Hospital in West Virginia. To keep Sherman's muscles from twitching during the procedure, he was administered a paralytic drug. Unable to move, doctors cut him open and began to search through Sherman's organs, physically shifting his insides about. Everything seemed to be going well. But for Sherman, the procedure was anything but well. What the surgeon hadn't realized was that Sherman was under the effects of the paralytic drug, but he hadn't yet been put under general anesthesia. Sherman, while being cut open and searched through, may have been unable to move or react, but he was fully awake and aware. He felt every inch of the incision, every poke and prod, but there was nothing he could do about it. After the surgery, Sherman's life changed dramatically. The experience was so torturous that it scarred him physically and mentally. He started to experience terrible nightmares and couldn't be left alone. The hospital didn't immediately admit to their error, causing Sherman to struggle with not knowing if his memories were real or not. It tormented his every waking moment. Eventually, he started to become delusional and believed that people were trying to bury him alive. Less than 1 month later, Sherman shot himself to death. Experts estimate that tens of thousands of patients experience what is called anesthetic awareness each year during surgery. While these instances may scare you, don't worry. You probably won't ever have this type of experience. Probably. I'd like to let you all know that Seriously Strange has its own Twitter. Here you can get extra doses of creepiness about anything from the bizarre and unexplainable to serial killers. If you just so happen to have trouble waiting for a new episode of Seriously Strange each week, you can go down into the description below and there is a link down there. Be sure to follow it. You won't regret it. That's all for now. Remember, you may not believe it, but anything is possible in a world so seriously strange. I'm Rob Dyke, and I'll see you next Wednesday, so don't forget to subscribe, because you won't want to miss what's next.